So the first thing I'm going to do is gather my supplies. I'm going to get my vial, my 1 milliliter syringe, my medication, my blunt tip needle, alcohol swab, and a medication label. And I'm also going to make sure I have my prescription order and my MAR. So my first I'm going to compare the history of the patient and allergies to the prescription to make sure the medication is compatible. And then I'm going to do my first check. So I'm going to compare the prescription to the MAR. So I'm going to check for right patient, right medication, right dose, right route, and right time. So then I'm going to check the expiry date on my vial and on my medication. And I'm also going to make sure that my secondary medication is compatible with the primary bag. So once I'm done that, I'm going to do my calculation first before I prepare the meds. So my dose ordered is 25 milligrams and my dose on hand is 50 milligrams per milliliter. So first, I'm going to figure out how much of the medication I'm going to inject into the bag. So I'm going to divide my dose ordered, divide it by dose on hand, and 0.5 milliliters. And also I'm going to calculate my drip rate. So the secondary bag has 50 milliliters in it. I'm going to be giving the medication, as the order says, over 30 minutes. And the drip factor is 10. So it's going to be 17 drips a minute. So now I'm going to prepare my medication. So I'm going to do hand hygiene. And then I'm going to do my second check. So I'm going to get my MAR. I'm giving dihydrogenate. And I'm giving 25 milligrams. I'm going to pull up 0.5 in my syringe and inject it into the secondary bag. So before I do that, I'm going to prepare the label. So I'm going to fill in the patient, Mr. Tutu. Drug is dimenhydrinate. And the amount is 0.5 milliliter and added by initial. So I'm not going to stick that onto the bag until I put the medication in. So I'm going to put that there. So I'm going to grab my syringe. And this is the wrong one. I'm going to grab my blunt needle. So before I start, I'm going to make sure to swab the top of the vial. Like that. And then I'm going to pull up 0.5 milliliters of air. Inject that in. Pull my medication. Okay, so we're gonna get a close-up of that. There's a bit of air in it. I'm actually gonna pull up some more. Okay. So 0.5 milliliters of medication. Okay. So, and then, once that's ready, I'm going to inject it into the bag. Okay. Inject it. And to disperse it around, I'm going to pull water out. and then inject it back in just to make sure that the medication's mixed in. Okay. And then I'm gonna dispose of my needle into the shards container, and I'm just gonna make sure the medication's mixed. And then once that's mixed, I can add my label. Okay, and once I've added that, I'm gonna do my third check. So I'm gonna grab my label and compare it to the MAR, diamond hydrogenate, 0.5 milliliters by me for Mr. Tutu. So then I'm gonna go and bring it into the room. So I'm gonna bring it to the bed and I'm gonna do hand hygiene. I'm gonna go, hi Mr. Tutu, my name is Julia. I'm a second year nursing student, and today I'm gonna be giving you some gravel. It's gonna help with nausea, and it may cause you to feel sleepy and maybe some constipation. Can I see your wristband, please? What's your name and date of birth?
Paul Tutu, January 28th, 1999.
Okay, perfect. And I'm just gonna check the IV site. No redness. Any pain?
Nope.
No pain? Okay. And then before I set up the medication, I'm gonna do my fourth check. I also checked for an allergy wristband, and there was none, so I don't have any problems there. So I'm gonna make sure I'm gonna have my MAR in the room. Diamond hydrogenate, 0.5 milliliters. Mr. Tutu. Okay. So what I'm gonna do is I'm gonna use the primary line to back prime. So I'm gonna take the secondary line down, and I'm going to first make sure that I get all the medication out from this line. So in order to do that, I'm going to open the clamp and make sure to hold the secondary line lower so that all the medication gets out. Okay. Then I'm gonna unclamp this, throw that into the waste, put it right here, and then I'm gonna grab my medication, take the cap off, spike it, and I'm gonna hang it up, and the line's already primed because I back primed. So then now, I make sure my clamp's on at the bottom, and I'm gonna unclamp this clamp. And so the drip rate was 17 drips per minute. So now I would look at my watch, which I don't have, and I would keep adjusting the clamp until I met a rate of 17 drips per minute. And to do that, I would calculate the amount of drips in like 20 or 30 seconds and multiply it, so it doesn't take that much time. So then once I have the drip rate set up, the medication is good to go. I would make sure to document it afterwards, and I would check up on the patient to observe for any pain, any swelling, any redness. And then when the medication was done, I would take the secondary line down, and I would adjust the drip rate back onto the primary line, and then that's it.